Hi everyone, welcome to the Urban Indian Health Institute's Health Data Literacy Training number 2. This webinar is the second in a series, and for today's webinar we will be talking about using and presenting data. So for those of you who attended the first webinar on accessing data, just a little side note that some of these introductory slides are going to be something you've already seen, so just bear with us as we make sure that everyone is on the same page. My name is Alyssa, and I am an epidemiologist here at UIHI. And joining me on this webinar is Shanoa, and I'll let her introduce herself.
Shach Maisky, good morning everyone. My name is Shanoa. I'm Yakima in Southern Cheyenne, and I'm a project assistant here at the UIHI. I'm glad to see you all today.
And then just a few housekeeping things. Please fill out the evaluation so we know what works and what doesn't work and what kind of topics you'd be interested in for the future. And let's get started. So just a quick acknowledgements here. Thank you to the American Indian and Alaska Native Health Disparities Grant Program and the Office of Minority Health for providing the funding for this training. Also, a big thank you to Shira Rutman, our evaluation manager and fellow epidemiologist here, as well for laying down the groundwork for these webinars.
So just to begin, let's give a brief overview about the Urban Indian Health Institute. Our mission is to support the health and well-being of urban Indian communities through information, scientific inquiry, and technology. So what that means is that we conduct a variety of public health and research projects that range from surveillance and analyses to technical assistance and trainings like these. We were established in the year 2000 as a division of the Seattle Indian Health Board. And as many of you may know, there's a gap in understanding information about urban American Indian and Alaska Native communities, and so we're here to fill in that gap. And we are one of 12 tribal epidemiology centers, and we serve the others, which serve on a regional basis, but ours is national. We also serve the Urban Indian Health Organizations, or UIHOs, and there's 33 of them. We have them laid out here, and the Indian Health Service has different service levels. There are comprehensive clinics, which is what we are here in Seattle, and there's limited clinics, as we see here, which provide primary care, but under 40 hours a week. There's also referral and outreach sites.
And so just to give you a little background on this training comes out of the UIHI project called Demystifying Data. And so demystifying data is about increasing the awareness of health disparities that urban natives face. And it does so in 3 ways: through information, through partnership, and through training. And so health data literacy training is to show all of you that you can work with data too. It's a way to translate these numbers and results into a tool that helps you to tell your story. And then another tool that is available to all of you is the previous in-person training materials. Back in 2009 to 2012, we used to do an in-person one-day training for UIHO staff and other interested agencies. And that training included topics like the importance of health data, data limitations, commonly used EPI concepts, effective communication, presentation of health data, and how to use it in your agency. And so if any of you are interested in those materials, please let us know and we can send it over your way. And after those past trainings, people had indicated in their evaluations that they wanted a step-by-step training on how to access data and how to use data. And so that's where the ideas for modules 1 and 2 came from. And so that's just another plug for you to please complete those evaluations. And then this slide just outlines our goals for today's webinar. So for today, we'll be looking at how to use data output for making graphs for presentations or reports, and then looking at how we can interpret the data for a grant or presentation. And so the first module also was on accessing data, and that is also available on our website and YouTube channel. So here's just a quick outline of what we'll be going over today. We'll be doing a quick review of Module 1, and then a refresher on some EPI concepts. And then we'll be talking about some options for presenting data, and then doing a demonstration in Excel on how to create one of those graphs that we talked about. And then we'll also be talking about a few of the different ways that we can interpret this data. And so just a quick review of Module 1.
So to start with, let's take a moment to discuss some of the challenges we face when it comes to data on natives. Firstly, sometimes data isn't shown for the group of interest at the county level or at the state level for American Indian and Alaska Natives. It may not just be broken down by race in that way. Secondly, sometimes the data is grouped into the other category simply because of the small sample size. And thirdly, sometimes the access to data sources just may be difficult. Maybe it takes more proposal time or cost, etc. And just a side note, often there's, as well as these ones, there's often misclassification, particularly pertaining to urban American Indian and Alaska Natives. I know in my own family, I think my grandmother was misclassified racially. So sometimes these are just a few of the in ways that data can be imperfect.
But although data can be imperfect, we can still use it. We can still use what we have available to us. And here are just a few suggestions on how we can use that imperfect data. So one method is to look at the area of analysis. And so we can look at aggregating multiple years of data, or we could expand our age range to include more age groups. A second method is to consider a comparison group. So one example is to use whites to highlight the disparity between natives and whites, or you could use another racial ethnic minority group as your comparison group as well. Or you look at all races as the comparison group. A third method is to look at alternative sources. So if you are unable to access the data publicly, you can also see if someone else like the CDC has interpreted the data and published a fact sheet or report on it. So for this demonstration, we'll be using the first two methods. We'll be looking at 5 years of data, and then we'll also be using whites as our comparison group for this demonstration. So in the first webinar, we went to CDC WONDER, and we accessed that data source online. We looked at the sexually transmitted disease morbidity query tool and clicked on that link right there. And then we went to the second data request because that's the one we're interested in since it has the race ethnicity information. And so we clicked on that link right there. And then we were given our query tool, and so we had options for how we wanted to set it up. And so we wanted to look at disease, at race ethnicity, and then gender to also narrow down our focus. And then we looked at Michigan because that's where I'm from. And then we looked at all diseases, and then we looked at the most recent 5 years of data, and then we looked at 15 to 19-year-olds just to focus our data, our analysis. And then we looked at all genders, and then we looked at American Indian and Alaska Native, and then whites as our comparison group. And then we kept the default of other options where we kept the totals, the decimal places, and then calculating rates per 100,000. And we'll talk a little bit more about this and why we use that 100,000 method. And so then we hit send, and then we got we get the results, and we get the diseases, and it's broken down by race, ethnicity, and then also by gender. And then we wanted to export the data. And so there are two ways that you could do this. You could take a screenshot by pressing Alt and print screen, and then pasting it into a Word document, or you can download the output into a text file and then import that downloaded data into Excel. And so that's what we're going to do today. And there's also a step-by-step instruction on how to do that if you follow this link. And it shows you how to do that through Excel, and also through Microsoft Access, and then also EpiInfo or SAS if you want to get really fancy. And so here is a text file that we downloaded from CDC WONDER when you hit export. And so we save that to our desktop. And so once we save it, we want to open up Microsoft Excel. And you can just open up a blank workbook. And then once you open that blank workbook, you can go to Data, and then you'll want to go to From Text so that we can import the data that comes from a text file. And we'll go to the desktop since that's where we saved our downloaded data. And we'll hit that. And we'll leave delimited at the default. And then we'll hit Next. And then we'll also leave the default of Tab. And then we'll hit Next. And then we will also leave the default of General, and then hit Finish. And so we'll hit the A1 cell so that the data appears right there, and hit OK. And then now we've exported our data from a text file into an Excel file. And so then we will save it to the desktop. And we'll also label it as the import file. And so this is how you export the data from a text file into an Excel file. So now that we have the data, let's talk a little bit about EPI concepts, just so that we can help frame the conversation and our discussion in how we want to present the data and how we want to interpret it. So just go over those concepts real quick. And so I'm sure you've all heard of something called prevalence. And prevalence is the total number of persons living with the disease at any given time. And so we're looking at old cases and new cases. And then we also talk about incidence. And when we talk about incidence, we're talking about the number of new cases of a disease in a defined population during a specified time period, usually a year. And so that only looks at the new cases, where prevalence only looks at the old. It looks at both the old and the new cases. And then just to highlight that, we usually use the bathtub or sink model to show the difference between prevalence and incidence. And so prevalence looks at all of the water that's in the tub, so all the old and the new cases. Incidence, though, it only looks at the new cases. And then once people get out of prevalence, it's usually only through death or passing over or recovery if they've been cured of the disease or condition. And so then another term that we talk about is the rate per 100,000. And so we'll look specifically at the Native females who have been diagnosed with chlamydia as our example here. So we look at the number of STD cases, and that's 221, and that's divided by the total population. And so then we get this decimal point of 0.01469. And so what exactly does that mean? Well, we want to make that intuitive or more understandable for others. And so we multiply that by 100,000 so that we can then say that the rate is 100 or 1,400 and 70 cases per 100,000 people. And so we'll also round up because we can't count only 0.41 of a person. And then, since we'll be comparing two groups, we'll also want to talk about something that we call relative risk. And so relative risk measures the strength of an association between two groups, an exposed group and a non-exposed group. And so some examples of relative risk are risk ratios and rate ratios. And so to get the relative risk, you do the risk or rate of the group of interest, which in our case will be natives, divided by the risk or rate of the comparison group, which will be whites. And so now that we have those ideas in our head and are refreshed with those terms, let's talk about some of the options for presenting data.
So we've got a few ways in which we can present the data. We can do it either in a table, in a line chart, in a pie chart, or in a bar chart. Of course, there's many other options, but these are the quickest, kind of simpler ways where you can really get at a good visual really easily through Excel. And we'll go over these one by one to see which one or the benefits of using each. So here's the table example. As you can see here, a table is very good for presenting a large amount of data or information in a very tightly compact way. You can look at the numbers and percentages and the confidence interval as well. Although I'm not entirely sure what a confidence interval is. You want to go over that real quick, Alyssa?
So I'm glad you asked that, Shanoa. So what is a confidence interval? So a confidence interval is really just a range that tells us that the true population, the true value in the population, there's a 95% chance that our range contains the true population value. And so another way to think of it is to think that if we were to take this measurement 100 times, 95 out of those 100 times, the true population value would be contained in that range. And so if you ask the biostatistician what a 95% confidence interval was, you get an even more complicated answer from that. So we'll just stick with that.
Mm-hmm. Well, thank you. It can help to understand some of these statistics and epi terms as well. However, if you put too much information on a table, it can easily get confusing, and we want to make sure that things are easily able to look at. So for our data, this might not be the best option.
So then some cons to using a table is that the comparisons aren't going to be as easy to see as in pie charts or bar charts. And sometimes there's a risk of presenting too much data, and then that can be confusing for the audience as well. So that might not be the best for our data, but let's see what other options we have.
All right, and this is the other way we can present data. This is a line chart. The benefits of using a line chart are that you can track change over time. As you can see here, this chart was taken over a period of 5 years, and we have these different values that we can really visually see how it's changed from 7.6 to 8.8. However, some of the cons with using this are that obviously we can only use data with quantitative numbers. Furthermore, this scale can be misleading. This line would imply that we have data in between 2013 and 2014, when in reality we only have data for the exact year. So at one point in time in 2013, at one point in time in 2014, not anything necessarily in between. And this is helpful to know, especially for some surveys, such as
like the National Survey of Children's Health. So for that survey, they take data for 2003, 2007, and 2011 to 12. And so when you would map those points, you would see just the data for those 3 years. But in between those years, there's 4 years missing where they didn't actually collect any data. And so on a line chart, it would look like they were actually collecting data during those missing 4 years in between, when in reality they weren't. So that's just something to keep in mind. And so for our data, that wouldn't we wouldn't want to use a line chart because we're actually aggregating and using multiple years of data. So let's look at what else we have available to us.
And here we have the pie chart. Pie charts are good for comparing categories with the total. So as we can see here, these are all part of understanding body mass index. And it works best when the sizes of the slices are, or the values are very distinct and different from each other. As you can see here, this one's at 1%, whereas this one's at 46, this one's at 8 and 22 and 23. That makes it very easy to tell which pieces are which in comparison to the whole 100%. However, sometimes it can be difficult to compare different sections of a pie chart, so that's one con. Furthermore, it can be difficult to compare data across different pie charts.
Yeah, and then also we'll want to keep in mind that to be careful about our color schemes and choices, because while the green might look really nice on the computer, if you print it out, it might look neon green. So you just want to do a test run to make sure it's how you want it to look. And then all of these categories should also add up to 100, or at least close to it, depending on how you're rounding up. And then for our data, we could do a pie chart where we would have to convert the rates into percentages and then outline it with like natives who have been diagnosed, or we could do it by disease where the pie chart showed chlamydia and all our 4 subgroups and what the percentages looked. But it would lose some of the richness of the data, so let's see what else we have available to us. Also, we have to be comparing 2 pie charts then, and between chlamydia and gonorrhea, and so we just have to keep in mind how it looks to the audience as well.
And lastly, what we have here is a bar chart, and this is the way we have chosen to present the STT data that we're going to discuss. The pros to using this, obviously, are that you can compare 2 and more values. You can compare the amount of frequency or occurrence of different characteristics. And it's best used when using maybe 3 to 4-ish comparison groups, as we can see here. Some of the cons are that obviously you can't display a 0 value because it wouldn't show up. And you definitely need some more labels for similar values, and it would have a less impact if the values are too similar. For example, we have this one at 44.8%, this one's at 16%, and you can see quite easily the difference between the 2. And this is the type of chart that we're going to use for our example today.
All right, and so this looks to be a good option for our data, and so we'll talk about how to make this graph where we look at the diseases and broken down by the 4 subgroups. And so just keep in mind also is that it's also important for you to think about how you show your data is how you makes a statement to the viewer or audience about what you think is important about the information. So for example, if you wanted to impact funding for interventions to prevent or help treat chlamydia, you might not want to show the information on gonorrhea. You might want to just focus on the chlamydia information. And then if let's just say that if your other question was to look at whether one STD was higher than another, you might want to look at, but you just wanted to focus on natives, then you would keep both chlamydia and gonorrhea, but then just focus on the native females and native males. So now going back to our data, we want to show all the information that we have just for this example. And so let's go through the demonstration. And so here we have our import file. And so this is the original file that we have. And so we want to keep the original file in case we ever need to go back to it, and so that we don't have to download the data again. And so for our template for the graph, we have our graph title, and then we have our population categories, and we'll have chlamydia and gonorrhea here. And then we also have it broken down by our subgroups right here. And so for our example, we already have it filled in. And so it's STD by disease and race among 15 to 19-year-olds, 2009 to 2013 in Michigan State. And so now to link the data in this sheet to our original file, we'll hit the equal sign on the keyboard, and then we'll go to import, and then we'll look for native females who have been diagnosed with chlamydia, and that's J2. So we click on that cell, and then we hit enter. And then we'll do the same thing for all of our categories right here. And so we will hit the equal sign here for white females, and then go back to our import file, and then we'll look for white females who have been diagnosed with chlamydia, and then click on that data cell, and then hit enter to link the cells to the original file. And so we already did this Martha Stewart style, and already filled in all the data cells. And so now that it's complete, we will highlight the data cells that we're interested in, and we will go to insert, and then we'll go to our 2D columns right here. And so with the 2D column, we have our diseases highlighted as our columns, and then we have it broken down by the subgroups right here. And so if we hit the switch row column, we can switch it so that we have the diseases on the horizontal axis, and then broken down by the subgroups that we're interested in. And so this displays the data a little bit more clearly, and so we'll go with this. And so to make changes to the chart, we can hit the plus sign here, or we can go to the add chart element over here as well. And so we'll add in our vertical axis so that people know that what we're talking about, because it's the rate per 100,000. And then we'll also add in our title up top. And then we will also add in our data labels so that people know exactly what each column means. And then we already have our legend. And so when we create a chart, we want to make sure that we have the title, the data labels for the axes, so the rate per 100,000 and the diseases, then also our data labels for the columns, and then also our legend so that people know what we're talking about. And so let's go back to the PowerPoint now that we've created our chart. And so you can also spend as much time or as little time as you want formatting this to make it presentable for your audience. And let me pull up the PowerPoint again. Okay. And then also when you're creating a chart, you'll want to include the data source so that people understand where you got the data from as well. And now that we've made our chart, let's talk about interpretation. So when we think about interpretation, we have to think about what message we want to send. What exactly are we interested in? Are we interested in looking at specifically Native females? Are we interested in comparing Native females to white females? Or do we want to look at the overall picture, the intersection of race and sex? And so I'm just going to go over a few of the different ways we can interpret this graph. And so just to remind all of us what it looks like. So for the interpretation for a single group, we're going to focus on Native females who have been diagnosed with chlamydia. And so we're looking at the blue column of 1,470 cases. And so one way that we can interpret this is to say that the incidence of chlamydia in American Indian and Alaska Native females aged 15 to 19 years in Michigan for 2009 to 2013 was 1,470 cases per 100,000 people. And so when we're putting together interpretation, we'll want to include any details like the specific age groups we looked at. And then we'll also want to include the geographic area and the multiple years of data, and also the rate that we're looking at it. And so also just a side note about the rate per 100,000, sometimes you might want to look at it per 10,000 or per 1,000 people. And so that will depend on the disease you're looking at. And so you'll want to use a rate where you have the smallest whole number. And then also you can look at how CDC fact sheets or reports have also displayed the data and look at what rates they're using as well so that you have a standard that you can go to. And then, so another way that we can interpret this data is to do a comparison where we look at the relative risk. And so let's compare Native females and white females who have been diagnosed with chlamydia. And so going back to the chart again, we have Native females in the blue, and then we have white females in the red. And so we take those two and calculate the relative risk, which is 1.3. And so one way we can interpret this is to say that for females aged 15 to 19 years in Michigan for 2009 to 2013, the risk of developing chlamydia for natives was 1.3 times the risk for whites. Or we could also interpret it a different way and say that for females aged 15 to 19 years in Michigan for 2009 to 2013, there was an increased 30% risk of developing chlamydia for natives compared to whites. And so that's one way, that's another way that we can interpret the relative risk. And so now let's talk about the overall interpretation of the graph. And so let's pull up the graph again. And so our main question was looking at the comparison between natives and whites. And so as we can see here, when native females had a higher incidence than white females for both chlamydia and gonorrhea, And then when we also look at Native males and white males, we see that Native males also have a higher incidence as well. And then when we look at this graph, we also see that we also want to look for any patterns that we see. And we see that Native females have the highest incidence for the 4 subgroups in both diseases. So that's something that we would also want to highlight. And so then one way we could write out this interpretation statement is to say that in Michigan for 2009 to 2013, the incidence of chlamydia and gonorrhea was higher for natives aged 15 to 19 years compared to whites. And among the 4 groups, Native females were at the greatest risk of developing chlamydia and gonorrhea. And so that's one way that we could interpret the overall big picture for this graph. And so those are just a few of the different ways that you can interpret the data that we put together and the chart that we just created together. But there are also multiple ways that you can do this. So, and what we just showed you is just one way that we would interpret it. And so we'll just do a quick summary of the key points that we talked about in this webinar. And so it's important to remember that the way we choose to present our data is almost important as the data itself. These days, we live in the age of information where we're constantly being thrown bits and pieces of information, all these data bytes. And it's not enough to have the data and to know it. We also have to share it in a way that speaks to people. And so we have to go back to that main question of what message am I trying to send? And we have to remember that the message you're sending with this data is someone's story. So let's make sure to share that truth with the respect and justice it deserves. And so thank you all for participating in this webinar. If you have any questions, feel free to let us know. Our contact information is on the last slide. And take care.